Risks of hip replacement surgery. I'd like to spend some time talking about the possible risks and complications that can occur when having hip replacement surgery. These risks are described on the consent form we will sign and review together if you decide to go ahead with surgery. You can also view the full consent form on this website. It's completely normal to feel concerned when hearing about the risks. The aim isn't to alarm you, it's to ensure you understand what could happen and what it might mean for you if a particular complication occurred. This is an important part of making an informed decision. Here are the main risks explained in more detail. Blood clots. A blood clot can form in the leg veins after surgery, causing swelling and discomfort. This is a deep vein thrombosis. We reduce the risk by using calf pumps, early mobilization, and blood thinning medication. Rarely a clot can travel to the lungs, called a pulmonary embolism. This can cause chest pain and breathing difficulties. If this occurs, you may need strong blood thinning treatment for several months. You may also need extra scans, monitoring, or hospital readmission. A blood clot can, in very severe cases, be a fatal complication. Heart attack and stroke. Major operations place some strain on the heart and circulation. This risk is low, but slightly higher if you have conditions such as heart disease, high blood pressure, or diabetes. We check your general health thoroughly before surgery to minimize these risks. A heart attack or stroke during or after surgery can be a serious complication. If this occurs, you may need urgent medical treatment or admission to intensive care. Recovery from your surgery may be delayed or complicated. A heart attack or stroke can, in very serious cases, be a fatal complication. Infection. Infection can occur in the skin around the wound or, more rarely, deep around the implant. We use antibiotics and strict sterile techniques to keep the risk as low as possible. Deep infection is a serious complication because bacteria can attach to the artificial joint. If this occurs, a skin infection is usually treated with antibiotics. A deep infection often requires further surgery to wash out the hip joint. Sometimes the implants need to be removed and replaced in stages, leading to a much longer recovery. Dislocation. A dislocation happens when the new ball slips out of the socket. You'll receive guidance on positions and movements to avoid early on after your surgery. This is most common in the first few months while the soft tissues are healing. If this occurs, you would need hospital treatment to put the hip back into place. Repeat dislocations may require further surgery. Wear or loosening of the implant. All artificial joints gradually wear over time. In some people, the components loosen earlier than expected. If this occurs, it may cause pain or instability of your total hip replacement. You might need further surgery to replace the worn parts. This is revision surgery. Ongoing pain or stiffness. Most patients feel much better after surgery, but a small number continue to have discomfort or stiffness. If this occurs, physiotherapy, medication, or further investigations may be needed. Sometimes the cause can be identified and treated. Other times, symptoms may persist. Nerve damage. Nerves near the hip can be stretched, bruised, or injured during surgery. If this occurs, you may notice numbness, tingling, or weakness. Injury to certain nerves can lead to foot drop, where lifting the foot becomes difficult, or cause persistent numbness in the foot or ankle. These symptoms often improve over time, but can occasionally be permanent. Leg length difference. Although the aim is to keep both legs the same length, small differences can occur, sometimes intentionally, to improve stability of your hip. If this occurs, most differences improve over time. A shoe insert can sometimes help. Rarely, significant differences may require further intervention. Fracture. The bone can occasionally crack or break during the operation or later after a fall. If this occurs, additional fixation with screws or plates may be needed. Sometimes a different implant or further surgery is also required. Blood vessel injury. There is a small risk of damage to nearby blood vessels, which can cause bleeding. If this occurs, the bleeding may need to be controlled during surgery. Occasionally, repair by a vascular surgeon or a blood transfusion may be required. In extremely rare circumstances, severe bleeding can lead to a fatal complication. putting the risks into perspective. Some of these risks, particularly blood clots, heart attacks, strokes, and severe bleeding, can very rarely be fatal complications. However, it's important to emphasize that these outcomes are extremely uncommon. The vast majority of people recover well and experience major improvements in pain and mobility. We take every possible precaution to keep all risks, both minor and serious, as low as we can. Understanding the potential risks allows you to make a fully informed decision about whether this surgery feels right for you.